Hi guys, today is December 19th, 2021, and today we're gonna talk about the Omicron variant, how it's taking a hold around the globe, how countries and governments are preparing, panicking, and get ready of what's gonna be the future in the next 3 weeks to 2 months. We are going to go through some of the news that I've been gathering around the world, and at the end we're going to talk specifically the steps we can take to be prepared. And I'm gonna go through the steps that I took back in the end of February, March, when I knew what's gonna happen. And why did I know what was coming? Because I was prepared. Because I had been reading since late December. I was following the news, what was going on in China, then Europe, and how it was spreading, and I knew that it was just a matter of time till it'll reach Canada. I'm not gonna read the news, I'm just gonna go through them. And by now we all know what's going on in Europe. France closed its borders with United Kingdom because of the Omicron variant Thursday midnight. Thursday before midnight, one of my contacts in France sent me a video from the train station, and it was awful. Everybody was panicking, everybody was trying to catch the last train before midnight so they wouldn't be stranded in France. Same thing was happening in the United Kingdom. People were trying to leave the United Kingdom to France so they wouldn't be stuck there. And you can go and Google it. You can see some videos of those train stations, and you can see those videos of the highways in England trying to cross the border. But what is remarkable here is that you can go and Google what was going on in Europe last year, and you can basically see the same situation. You can basically see the same pictures. People is panicking, and we need to be prepared. Netherlands, they have implemented the strictest lockdown in Europe starting tonight. Bars, non-essential stores, gyms, everything is closed. Only essential stores are allowed to be open. Many cities across the world now are planning on canceling New Year's Eve celebrations because they know that in the next 2 weeks this is going to get worse. In Canada, last Monday, if I'm not mistaken, Prime Minister Justin Trudeau announced that the government was really concerned because of how the Omicron variant was spreading around the country. The Canadian medical chief, Theresa Tam, said that she is expecting that how fast this variant is being transmitted, and we're still dealing with the Delta variant. She is talking about 26,000 daily infected in Canada by mid-January. That is at a federal level. Now we're going to talk about provincial level. Ontario medical chief said that one layer protection masks is not enough. Forget about it. As a matter of fact, he says, throw them away. He's talking about a minimum, a 2-layer protection mask, or 3. He even talked about N95 and then backtrack his comment, and then he says, well, N95 for frontline workers. I'm sorry, guys, but I think everybody's a frontline worker. If you are a carpenter, if you are a plumber, if you are an air conditioning technician, if you are an electrician, if you are a janitorial, and you need to deal with customers or the public, sorry guys, but to me, you are a frontline worker. And you should be wearing KN95 or N95 or a minimum of a 3-layered mask. Here in the province of Manitoba, they just released a tweet. I got the tweet. I'm going to post it. And then you go to their website and pretty much the restrictions are coming back. Fully vaccinated people can gather up to, if I'm not mistaken, 12. And unvaccinated people up to 5. And they are talking you should be vaccinated from 12-year-old and up. I just talked to my cousin that works at a hospital, and he was telling me that he just got a memo saying that now they can opt for their vacations to get paid instead of taking them while they are working. So hospitals are no, the health system is no, that is going to be struggling pretty soon. And now they are giving you that option. But as we were talking about it, pretty soon or eventually, it might be compulsory. You don't take vacations, you work, you get double pay. And we were discussing that probably the union, because of the agreements with unions and hospitals, is not going to happen. But hey, when it comes to an emergency, when it comes to a public emergency, unions and hospitals can agree on the steps they are going to take in order for protect people. The province of Manitoba just admitted that our health system, it's really struggling, that they have asked the International Red Cross to send nurses. Our nurses are totally burnt out, doctors are burnt out, and now we are dealing with the issue that we need more staff. Now, if this is happening here, I bet you in Manitoba, I bet you it's happening across Canada, in the States, and in whichever country you live. No matter where you live, same situation is happening. New York is expecting to be the epicenter again of this new variant. I just got that news. So if you can see it, it's around the globe. This is happening around the globe, and we are living similar, if not same circumstances that back in March, when everybody starting to close borders, implementing lockdowns, etc., etc. We all lived through this, so you know. But the most important here is I'm going to give you my advice, not from a theory perspective, but what I did, which steps we took as a family. And sorry to repeat it again, guys, and I'm not putting anybody down in the preparedness community, but my experience is of 41 years. In a country where there was a civil war and where we managed to live, protect our loved ones, and thrive. So please pay attention. This is the steps that I took, that we took as a family a year or so ago. Like I mentioned it before in this video, March 2020, I knew it was coming. I mean, all the indications were that this virus was already in Canada, but the government hasn't taken that drastic measurements yet. So what did I do? One, I went and talk to my supplier, get N95 masks, get gloves, and get ready. I went to the stores and bought 3-layer masks. We didn't know at the time how bad, how deadly, how transmissible was the virus. And then I went to the store, Home Depot, and bought 6 respirators for my immediate family. I phoned my relatives, phoned my friends, told them what to do. Some of them laughed about it. That's okay. I told them what was going to happen. Secondly, we decided as a family that our kids were going to come to our place and we were going to stay here because we have seen what was going on in Europe, the type of lockdowns that Germany, Spain, Italy was implementing. So we knew that it could be just a matter of a month and a half that we were going to be living through that type of lockdowns. So number 2, we all came to one place. Number 3, we decided who was going to go out to do daily errands, pick up medicines. In this case, by then, buy the food, go to work, so we would minimize the risk of a transmission. 4, you set up a disinfected area in your place. If you live in a house and you have a garage, do it in the garage. If you are in an apartment or a condo, set up in a specific place. My family back in El Salvador went as far as to create an enclosure with plastic. Have a tray on the floor. You would go, you will step on the tray, you disinfect your shoes, you go into that plastic enclosure, you get undressed, you take a shower, you go into the house. The result of that measurement back in El Salvador is that none of our family got sick. And you always, constantly read the news. And remember that for every mile of road, there are 2 miles of ditch. Meaning, you don't trust one source. You don't trust the other source. You gather all the information and you make a rational decision. Usually, the truth lies in the middle of the road. Then check in your area, or by now maybe you know which stores are going to providing with delivery service. If you cannot assign one person in your group to go out and do the purchasing and do whatever needs to be done, try to use the delivery system service. Buy your groceries. I know it's going to be a bit more expensive, but it's worth it. They bring the groceries to your doorstep. You pick them up. You disinfect everything, no matter what it is. No matter if they tell you where fruits, you don't need to. You just wash them in water. No. You disinfect them. And if you don't want to use a disinfectant, grab water and bleach. 10 parts of water, 1 part of bleach. Submerge them. Let them rest for 2 minutes. Get them out. Rinse them with water. Dry them. Now it's disinfected. Now the skin is disinfected. You can peel it off, and whatever was outside is not going to go into your food. It's not going to be contaminated. And that's how we managed to go through this pandemic. And here as well, that in El Salvador, none of us got sick. I'm happy to report that nobody in my group got sick because we took it seriously. Remember, if governments are taking steps, if governments are panicking, I'm not going to say that they know something that we don't know. They might. But what do we know as far as today is that is 6 times more transmissible than Delta. That according to the spikes and proteins, it doesn't matter if you are fully vaccinated or if you have antibodies because you already had the disease, the chances of getting this new variant are high. Those are the things that we know. And we should be taking care according to those things. Guys, you gotta remember that it's better be prepared than sorry. Take care of your loved ones. Take care of yourself first. Because if you don't take care of yourself, you're not gonna be able to take care of your loved ones. Take care of your family. And remember, again, better be prepared than sorry. Bye, guys. Have a good day. God bless.